диагноз поставили параноидальная шизофрения, а именно то, что у меня якобы, оказывается, бред.
I was diagnosed with paranoid schizophrenia. They said that I suffer from convulsions. Every appeal I submit is for a reason. I have evidence, photos, videos, etc. I even wrote to the president's virtual reception. This is a crime. In this day and age, they are sending a human being to a psychiatric hospital to strip him of his right to appeal in court.
Человека за его неактивность в психиатрическую больницу, чтобы лишить его права на обращение.
49 years old David Bagmanyan was an entrepreneur in the Uzbek city of Akhangaran. He had a shop and a garage which he rented out. One day, the city council decided to demolish his shop, garage, and 2 other properties which he owned. This decision not only finished his business career, but also changed his life dramatically.
3 апреля 2019 года я был задержан в ГУВД города Ахангарана, Ташкентской области.
On April 23, 2019, I was detained by the police of Akhangaran city of Tashkent region and taken to the city police station. The deputy chief of the city police department, Zafar Nazarov, told me that Akhangaran city court had issued a ruling that I had to undergo a psychiatric evaluation. The officer took me to the state psychiatric hospital. Before he did that, I asked what would happen if I refused to go. He told me, "We would have to enforce this decision and handcuff you." I was taken to the psychiatric hospital in Sergeli district. I was held in ward number 1 with restricted entry. Restricted entry means that there are bars on the door and windows. I was held with people who had been there for 4 or 5 years. I was detained for 30 days.
Держали 30 дней.
The court issued a ruling that David Bagmanyan was incapable of taking decisions due to his mental health problems, following a complaint that was submitted to the court by the Akhangaran city administration after David began filing complaints about the demolition of his property. David Bagmanyan is not the only victim of punitive psychiatry in Uzbekistan. Punitive psychiatry is the misuse of psychiatry, including diagnosis, detention, treatment for the purposes of obstructing the human rights of individuals or groups of people. This definition was given by the Global Initiative of Psychiatry, an international foundation for mental health, which took part in the campaign against the political abuse of psychiatry in the former Soviet Union. Punitive psychiatry was widely used in the former Soviet Union as a means of silencing dissent. Intellectuals and human rights defenders, including Joseph Brodsky, Valeria Novodvorskaya, and Andrei Sakharov, were all forcibly detained in psychiatric hospitals. Uzbekistan continued this barbaric Soviet tradition. Policemen were mocking me. They were smoking cigarettes right in my face. They insulted me. They forbade me to go home and talk to my doctor. They insulted me in every possible way, and finally, they called the psychiatric team. This is Elena Urlaiva, famous Uzbekistani human rights defender and one of the loudest voices against forced labor in the Uzbekistan cotton industry. She was forcibly committed to psychiatric institutions several times in 2001, 2002, 2006, and 2016. And this was happening despite the fact that an independent psychiatric examination concluded that she suffered from no mental illness.
By putting Elena Urlaiva over and over and over again in psychiatric institutions, they're not only saying that Elena is not to be believed, that she is somehow unreliable, but also that therefore her criticism of the government is therefore unfounded or unreliable. And it makes activism itself a sort of crazy. Like, you'd have to be crazy to fight against this government, right? In reality, it takes a lot of courage and a lot of fortitude to take action against a repressive government and to speak out. But it's not crazy. It's not the same. It's not mental illness.
Forced psychiatric treatment is a method of punishment. Elena wasn't told what kind of medication she was being injected with or forced to take. However, she later managed to find out the names of a few drugs, among which were sulfazine and haloperidol. Sulfazine is a drug which causes increased body temperature and severe pain. Sulfazine was widely used in the Soviet psychiatry to treat schizophrenia, and it is still being used in some countries today, such as Russia, Belarus, China, and Uzbekistan. However, it is not used in Western psychiatry. Haloperidol is an antipsychotic medication which is used to treat schizophrenia, tics, bipolar disorder, and acute psychosis. Haloperidol can cause continuous spasms and muscle contractions, motor restlessness, and epilepsy.
You have the high fever, of course, and you have the pain, and you have, it is described as you have fever above 40 degrees, and that high temperature is not healthy for your cells in your body. So it might sort of damage vital organs in your body, the cells in the body. In addition, of course, that when you have a lot of fever, a lot of pain over several days, you're not drinking enough, not eating enough, and if they are injecting that several times, it will affect the whole body.
In September 2019, Uzbek blogger Nafosat Alashukurova was detained while filming a peaceful protest. Urgench City District Court issued a ruling to place her in the regional psychiatric hospital in Khorazm region. She was kept there for almost 3 months. Like Elena Urlaiva, she was forcibly treated with drugs she was not informed of. Both women described the effects of these drugs as they are described by clinical pharmacologist Sigrid Narun.
When you give a person high doses of the dopamine blockers, the neuroleptics, it will affect, well, the usual adverse effects is that you will be sort of heavy in the arms and legs. You might have Parkinsonism symptoms. So you will be very slow in your reactions. Maybe your fingers feel so stiff you're not able to write. And they also might have acute dystonia as effects. That is, dystonia is painful muscle spasms. And a third adverse effect that is quite common is something called akathisia. It is an inner restlessness, inner or physical restlessness that is described as extremely unpleasant.
I've known Elena now almost 20 years and remember her clearly as a very vigorous, energetic, and active human rights defender. And she remains vigorous and active. However, it's really clear also that her repeated abuse by the authorities has had a negative effect on her health. I mean, the psychiatric detention, the forced psychiatric treatment, but also the physical beatings, the detentions, the evasive, intrusive searches, and just her dehumanization at the hands of the police. I mean, she has been dragged and beaten and stripped and poked and investigated in almost every kind of inhumane and humiliating way.
Psychiatric clinics in Uzbekistan resemble prisons rather than institutions which are designed to treat and care for patients.
It is shocking what was happening with me in this hospital. There is no psychiatric help there. There are no human rights. Any question you ask, there's only one answer. This is a psychiatric hospital.
Jamshid Karimov, nephew of the previous Uzbek president Islam Karimov, was forcibly placed in a psychiatric hospital for 11 years. Neither he nor his relatives have seen a court ruling about his forced hospitalization. Prior to his detention in a psychiatric clinic in September 2005, Jamshid Karimov was writing articles for various independent international publications and was critical of the policies of his uncle, the president.
Вообще режим сам по себе пропускной режим, я впервые столкнулся с этим.
In general, the system of management there is strictly controlled, and everyone has to wear a security badge. I witnessed it for the first time in my life. I read a lot about prison camps in the 1980s, about the gulags, etc. But I faced such harsh isolation for the first time. I was completely cut off from the world. Only the police and chief doctor were allowed to use mobile phones. The rest of the staff, absolutely not. When nurses, cleaners, and cooks arrived at work, they were told, "Give up your mobile phones." The phones were switched off and taken to the policeman's room. Mobile phones were returned to them only once they left work. Moreover, when investigators, prosecutors, and lawyers came, they too had to leave their phones at reception. Gates were opened only by security personnel. Doctors or any other medical staff who were running back and forth didn't have the right to open the gates. The presence of policemen was a must. They opened and closed the gate. They were very strict. This is purely a police institution. Can you imagine? There were handcuffs, police batons, metal detectors. Guards were carrying pistols. I saw those myself. There is nothing close to a hospital there.
Все как полагается. От больницы там ничего, в общем-то, не было.
Jamshid Karimov was released in early 2017, a few months after his uncle, Islam Karimov, died.
I think this is the particular sort of weaponization of healthcare, because putting activists in psychiatric institutions has two immediate consequences. The first is it silences them and disappears them, so they no longer have a voice, they can no longer criticize, they can't attend demonstrations, and they're literally not visible in society. And the second thing it does is it discredits them. It completely discredits them and as insane or as untrustworthy. And so it also discredits the criticism.
In April 2021, Uzbekistan adopted a new law on psychiatric treatment. In particular, this law stipulates that psychiatric treatment should be administered only with the agreement of the patient. It also gives the right to patients to have access to the information about their psychological condition and about their treatment plan. The law also stipulates that patients can be kept in hospital only for the period of time which is required for their treatment. Although this law is a step forward, it falls short of recognizing physical and mental pressure in psychiatric hospitals or any other institution outside of the court system or justice system as a torture.